What are the next big things that, from your perspective, you see in women's health?
So I think just the raising awareness of everything, I think is so key. It's led to increased funding for women's health research. And just like the advocacy that people are doing is super exciting. Because, we were kind of joking before the podcast, are there great women's health innovations? No, I think women's health in general has been very neglected. But just the raising awareness and putting the pressure and like showing the need for innovation, I think is probably the most exciting thing.
It is. It's kind of like raising awareness, having that billboard sign and letting people know that this is something that's important and impacts half of the population. Half of the population are women.
It's so literally half of human beings.
Probably pay attention to them. When we think of innovations in PCOS treatment, what are you excited about?
So actually the GLP-1s has been kind of a game changer, especially for those who have struggled, they've done everything right. They just kind of feel like defeated, like, no matter what I do, I'm kind of not making any sort of difference. You really see that transformation. So again, it's not about just like, we give it to everyone or use it like kind of, too casually. But it is really exciting to have this option for people who just need that extra step.
I think that when we typecast medications to a certain diagnosis, that's where we have issues with helping people understand just how much it impacts from a GLP-1 perspective, the rest of the body. So for me, PCOS, as soon as I started to see some of the best utility of GLP-1s, I was like, I bet that this is going to be something that can really be in the PCOS world as far as a treatment. How are things changing in the way that we discuss PCOS? You made a nod to it about increasing awareness, but what would you say about bringing awareness and changing how we discuss PCOS?
Yeah, the aspect of the metabolic health, that again, it's not just about like periods and it's not just about your ovaries, about, your overall health and how it's tied to, your insulin levels, weight management, energy, all of those things. So I think just kind of like changing the framework of it has been so key. And there's more and more research now about things like, like low carb diet, what are the differences that, like your nutrition is going to make. I think like kind of taking that different lens of it and kind of zooming it back out to kind of take the whole person into consideration.
I think that there is such a different perspective on health, individuality of it, personalized.
Personalized, yes.
Personalized, and then also from a women's reproductive standpoint, because it was this expectation of you're a woman, you should be able to reproduce, and then that was the end story. And there's so many kind of obstacles or changes in the path as one is going through their entire life cycle as a woman that we really needed to not just place people in a box, but we needed to be able to say, if you're having these issues, let's really take a step back and understand you as a person, but also how to create more empowerment within women so that they can navigate those journeys in the best way that they can.
Exactly.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.